Hi all, welcome to Raaonline. Today we are going to deal with anesthetizing one surgical specialty that is quite interesting and challenging. Why it is challenging? Because these patients are at higher risk for cardiovascular morbidity and mortality than any other surgical specialty. Why it is interesting? Because there is an expanding use of endovascular technique. New endovascular equipments are coming up and it is expanding. And improvement in medical therapy over vascular disorders and evolution of evidence-based approach to this patient have made vascular anesthesia more interesting. The broad outline of vascular surgery is peripheral vascular surgery, which includes your femoral and the popliteal artery as well as the upper limb arteries. And next is going to be your carotid endarterectomy. And when you involve aorta, it can be either abdominal aortic or thoracic aortic. The aorta below the diaphragm is abdominal aorta and above the diaphragm is thoracic aorta. These are the various surgical structures which are involved with vascular surgery. Coming to peripheral vascular disease. Here you might have an atherosclerotic disease in the distal part of the femoral or popliteal. So your vascular lumen is compromised or totally occluded so that the blood supply to the lower part of the obstruction is not there. When the blood supply is compromised, your muscle is going to be danger. Muscle necrosis start, and if you allow the ischemia to prolong, there can be gangrene and non-healing ulcer, which is called critical limb ischemia. Coming to carotid endarterectomy, here there is going to be a plaque in the carotid artery which reduces the blood supply to the brain. What you do is you take control of the proximal and the distal part, open the carotid artery and you remove the plaque and you establish the blood flow and later suture the rent which is made over the carotid artery. That is carotid endarterectomy. Coming to aortic surgery, 1/3 of aortic pathology will be in the thoracic part. Fortunately, 2/3 is in the abdominal part. In the thoracic part, majority of the pathology is in the ascending aorta and 40% will be in the descending aorta or distal to the arch. But when you take the abdominal aorta, only 20% of the pathology is above the renal artery and more than 80% is just below the renal artery. So whenever you talk about abdominal aortic pathology, you talk in the form of suprarenal and infrarenal. Now coming to the pathology of vascular disorder. Usually whenever some pathology of the vascular lumen is involved, there is going to be endothelial dysfunction, monocyte infiltration and your extracellular matrix remodeling is going to happen. It results in two major vascular pathology, that is either aneurysm or plaque formation. And if this aneurysm happens to be in the cerebral circulation, there can be vessel rupture, hemorrhagic stroke or there is going to be vasospasm which can cause cerebral ischemia. If it happens in the aorta, there is going to be vessel rupture which leads to hemorrhage and systemic hypotension. If there is plaque formation in the cerebral circulation, there is going to be plaque rupture and thrombosis of that plaque which may cause ischemic stroke and hemiplegia. If it happens in the peripheral circulation, it is going to be peripheral vascular stenosis, there is going to be claudication and patient might develop critical limb ischemia, finally leading to amputation of the limb. Now coming to the principle in which vascular surgery is done. There is only one main thing which you have to do in surgery. You have to get control over the proximal part and the distal part so that surgery on the pathological atherosclerotic part can be done. For that, you use a silastic loop so that you have the proximal control and the distal control, and this part is free of blood flow, so the surgery can be done. Coming to various procedures of vascular surgery, the first and foremost is the patch repair, where you place a nick over the pathology and try to correct it and then cover the rent with the patch. Either you can use a pericardial patch or a artificial patch. End-to-end anastomosis. Here, one part of the vascular lumen might be narrowed. You try to resect that part and make end-to-end anastomosis. Or bypass grafting. Whenever a vascular occlusion or some vascular pathology is there, you do a bypass grafting. You try to overcome the obstruction in that particular part using a conduit or a venous graft. Endarterectomy. You remove the plaque. For example, a plaque is causing an obstruction in the carotid artery. You make the carotid artery and you remove the plaque. That is called the endarterectomy. Or you try to remove the embolus using a Fogarty catheter. That is called embolectomy. And nowadays, endovascular surgery has become very prominent, overcoming the open